Welcome to this presentation from the Office of Aging and Disability Services, entitled Applying to Become a Waiver Provider. This presentation is for prospective waiver providers for the Section 18, 20, 21, and 29 waiver programs. The purpose of this presentation is to provide prospective waiver providers with introductory information about the Office of Aging and Disability Services, as well as the Section 18, 20, 21, and 29 waiver programs. Our goal is that after this presentation, you will understand key waiver program requirements and DHHS expectations of waiver providers, such that you can determine whether or not you want to pursue delivering waiver services. Additionally, if you decide to pursue delivering waiver services, we also hope that this presentation will help you understand the application process. In line with our purpose and goals, the agenda for this presentation includes 3 topics. First, I will describe what we do at the Office of Aging and Disability Services, as well as our overarching mission and vision for our work. Second, I will outline key waiver program requirements and DHHS expectations of waiver providers. Finally, I will describe the details of the waiver provider application process. I would like to take a moment to briefly introduce you to the Office of Aging and Disability Services, also known by the acronym OADS. Our vision is that all adults will experience individual dignity through respect, choice, and support. We focus upon those Mainers that are our older citizens, vulnerable adults, and adults with disabilities. Our mission is to promote their highest level of independence, health, and safety. It is difficult to summarize all the work done by OADS employees who work across the state in different capacities. Broadly, OADS supports older adults and adults with disabilities through many different long-term services and supports, including Section 18, 20, 21, and 29. We also oversee Older Americans Act programs and administer the Adult Protective and Public Guardianship or Conservatorship program. I also must highlight the work OADS does to support case management agencies for adults with developmental disabilities, as well as DS crisis prevention and intervention services. Every prospective waiver provider should start by reading relevant portions of the Main Care Benefits Manual, also known by the acronym MBM. OADS commonly receives questions about the scope of waiver services, reimbursement rates, and provider qualification requirements. Information like this can all be found in the MBM. You should begin thinking at this early stage about which covered service or multiple covered services you would like to deliver. Later, your application must include this information, using language that corresponds with MBM and relevant procedure codes. Here is a tip related to waiver services and the MBM. Don't forget Chapter 1, Section 6, which is often colloquially called the HCBS Global Rule. Every prospective waiver provider should also be familiar with the DHHS rules that are relevant to the individuals they would serve. You will need to train any staff on relevant rules, include them in your agency policy and procedures, and reference them in your quality assurance and improvement plans. Here is a tip related to DHHS rules. If you subscribe to receive updates from OADS on the homepage of our website, you can stay up to date on proposed policy changes and also have opportunities to weigh in. Every prospective waiver provider should understand that home and community-based waiver services are delivered such that individuals can receive services in their own homes and communities, rather than institutions or isolated settings. Home and community-based services are often referenced by the acronym HCBS. You will likely remember that earlier in this presentation, I referenced Chapter 1, Section 6 of the Main Care Benefits Manual, the Global HCBS Waiver Person-Centered Planning and Settings Rule. The HCBS Settings Rule emphasizes individual choice, control, and community inclusion. Here is a tip related to the HCBS Settings Rule. The OADS webpage for this initiative includes many detailed sample policies and trainings, which could be quite useful when developing your knowledge base in agency-specific policies. Every prospective waiver provider must understand person-centered planning requirements. Of central importance is the tenet that waiver services are determined through assessment of functional need and personal preference, not provider preference. Services should occur in the most integrated setting appropriate. Here is a tip related to person-centered planning. The OATS PCP webpage includes a detailed instruction guide. While many actions within the guide are for the conflict-free case manager, waiver providers will have a much better understanding of their part in this process, including writing the service implementation plan, after a close read of the entire guide. I will now turn to the last portion of this presentation, describing the details of the waiver provider application process. Learning about the work of the Office of Aging and Disability Services, as well as key waiver program requirements and DHHS expectations of waiver providers, may lead some prospective providers to decide that they cannot continue with the application process at present. For other prospective waiver providers, you may have determined that you know the appropriate service that you want to deliver, can meet all provider qualification requirements, and understand relevant rules and regulations. After that point, prospective waiver providers should turn their desire to deliver waiver services into a clear plan. You should develop or make changes to an organizational chart, job descriptions, and agency policies, demonstrating understanding of waiver program requirements and how you will meet them. After that point, please fill out an application and submit it via email, along with supporting materials. Sometimes prospective waiver providers indicate that they don't quite understand the roles of various offices within the Department of Health and Human Services. You should begin with the Office of Aging and Disability Services. If approved, you should apply to the Division of Licensing and Certification if required for the service you plan to deliver. After a license has been obtained, if required, all prospective waiver providers that have been approved by OATS should submit a request to enroll as a waiver provider with the Office of Main Care Services. If you have any questions about that OMS enrollment process, please reach out to OMS Provider Relations and ask to speak to a staff supporting waiver providers. Thank you for reviewing this presentation, and we hope that you found it to be helpful. Please reach out to us if you have any questions.